Duchenne muscular dystrophy is the topic for this video. DMD is a X-linked recessive disorder, and because of its genetic inheritance, it affects boys, and they usually are normal at birth, but they can start presenting symptoms around age 2 to 3. So what's happening in this DMD? Well, what happens is there is a mutation in a gene called dystrophin. And dystrophin is very important because a protein that is in the muscle cell membrane. And when this protein has a mutation, it can cause gradual muscle weakness. And that muscle weakness can eventually lead the child to become wheelchair bound, usually by about age 12. And the child can also have significant difficulty with walking, getting up from a position on the ground to standing up. The child can also have difficulty running or jumping, or anything that would involve the lower extremities. There's a couple of very characteristic presentations. This right here, this is known as Gower's sign. And Gower's sign is referring to when the child actually cannot get up without the help of his hands. The child has to walk up the legs when going from prone to upright position, because he doesn't have enough muscles power to get up normally. So as you can see, the child is using his hands to kind of walk himself up, because he just can't do it because his legs are so weak because of this muscular dystrophy. So that's Gower's sign. There's two types. There's Duchenne muscular dystrophy, and then there's Becker muscular dystrophy. They're the same, but it's just that Becker's is a little milder. Its symptoms don't present usually until about age 15, whereas Duchenne presents around age 2 to 3. And Duchenne muscular dystrophy patients usually die by age 20 because of respiratory failure, whereas Becker's can survive till about 30 to 40 years of age. So that's the main difference. Other than that, the symptomatology is pretty much the same. Alright, so let's talk just a little bit more about the symptoms. Both of these, DMD and Becker's muscular dystrophy, both have the same symptomatology. It's just when it happens differs. So we have difficulty walking, we have frequent falls, and then later the child can develop cardiac and respiratory problems. And the respiratory problems are usually the cause of death by age 20 in Duchenne muscular dystrophy. So how do you diagnose this? Well, the diagnosis is actually pretty difficult because it involves some pretty complicated tests. You have to actually do a muscle biopsy. And the muscle biopsy is what is going to allow you to analyze the dystrophin protein and allow you to check if this dystrophin protein is indeed have a mutation, and that really is suspected if the clinical presentation matches the disease. So if you have a young child about 3 years old, progressive weakness in the lower extremities, is not able to walk or run or jump or stand, then these types of specific tests can be done. Because the DMD also affects the heart, cardiac tests such as an EKG and echocardiogram are also done as part of the diagnostic workup. So then let's say you have diagnosed the person with DMD. How do you treat it? DMD is treated with supportive measures, really. There's no actual cure. So you have to actually put the person through active and passive exercises. And those active and passive exercises are done to strengthen the patient's lower extremities. Other things that are used are leg braces and ankle-foot orthosis. These can help with stability and posture, and can help prevent the contractures that they get. And it can also help the person with ambulation or standing. And that's really all there is, really, that you can do. The only medication that's used is prednisone, and prednisone is used because it can improve muscle strength, and the muscle strength with daily prednisone can probably improve by about 10%. But the problem is that prednisone, because it's a steroid, has a lot of side effects, including weight gain and those Cushingoid faces with the bloated cheeks that you commonly see with people on steroids. And really, unfortunately, that's all there is with the treatment. There really isn't much more. Because of the cardiac complications, you probably need to have the child take some cardiac medications, like ACE inhibitors or beta blockers. But that studies have shown that can slow the progression of the cardiomyopathy that patients with Duchenne muscular dystrophy develop. So I just wanted to end off with a couple of vignettes, and here we go. A 3-year-old boy presents with a history of ambulation delayed until 18 months of age, toe walking, calf hypertrophy, and proximal hip girdle muscle weakness. His pediatrician, considering a mild static encephalopathy, did not request screening for myopathy, but referred him to an orthopedic surgeon who found that his creatine kinase levels were greatly elevated, indicating need for referral to a neurologist. His siblings, a boy of 6 years of age and a girl of 7 years, are apparently well. The most likely diagnosis is, well, the fact that he's only 3 years old and he's already presenting probably knocks out Becker's, because that doesn't present until age 15. But the fact that he's already got this toe walking and the muscle weakness leads to this diagnosis. The creatine kinase levels being greatly elevated also supports the diagnosis of Duchenne muscular dystrophy. Next and final one, a 9-year-old boy is seen in the pediatrician office for supervision visit. The mother states that he has Duchenne muscular dystrophy. On examination, he is found to have a hip waddle and enlargement of both calves. He is ambulatory, but his muscle strength is diminished symmetrically. Which of the following signs is most consistent with Duchenne muscular dystrophy? We talked a little bit about this, Gower sign. And just to refresh your memory, Gower sign is illustrated in this diagram here, where the child has to walk up the legs when going from a prone to upright sitting position, because he does not have enough proximal muscle power to get up in a normal fashion.